Let's shift focus now and get you some updates from the state of Karnataka now, where the state government in Karnataka has now asked all the chemists to note down details of people who are buying over-the-counter medicines for cough, fever or cold. The medicines such as anti-inflammatories which are taken for fever, anti-allergic taken for cold or cough medication bought over-the-counter will be monitored by all the chemists and also by the state. The chemists have been asked to keep a track of all those purchasing these common drugs such as paracetamol, ibuprofen or even cetirizine over the counter. The district health officers will monitor this process on a daily basis. Let me go across to my colleague Shrija, who's joining me live this morning with those updates. Shrija, good morning. It seems that the Karnataka government has modified its tracking policy. Tell us about this process that has been put in place and what is the rationale behind it?
Well, good morning to you, Apurva. In fact, we are looking where Karnataka government is planning to boost its screening policy. We are talking also about the tracking people, especially with COVID symptoms, including the SARI patients as well. But what we see, what's coming, the update from the Karnataka government is that they have drafted certain rules. Now, these rules will be shared with especially the chemists and druggists across Karnataka, the state of Karnataka. So they're trying to track the details of the individuals who purchase over-the-counter medicines, including we're talking about paracetamol. Even if a person experiences cold or even cough, now their details, including the name, phone number and address, will be jotted down and then handed over to the district health officers, after which we understand they try and monitor the condition of this particular individual who had bought the over-the-counter medicines. Remember, we're also talking about the antipyretics, in fact, the paracetamols, the cetirizine that you're talking about, even the basic cough and cold medicines, even those purchased by the individuals will also be mentioned in their record, and after which they will also, especially these individuals, will be contacted to find out if they have any such symptoms. Now, basically, this is being done especially to, in fact, track and bring down the mortality rate, and also we are talking about people who are having SARI cases and influenza-like illness. This is to track and also we understand to ensure that the COVID-19 does not increase. So this is just being done where we understand as far as the tracking policy is concerned, because remember, just as on yesterday, we see 5 p.m. we see the cases have touched nearly 445 people have been tested positive for coronavirus in the state of Karnataka, out of which 17 deaths have taken place. But what we see is that there is a latest update coming in where it talks about the 18th death that has taken place in the state, in the district of Dakshin Kannada, and we're also talking about where nearly 145 people have been discharged. So this is just being done, expanding the screening policy as far as Karnataka is concerned, to ensure that people who are having such even the simple of symptoms, so that they ensure they can in fact arrest the problem early and not aggravate as far as COVID-19 is concerned.
All right, Shrija, many thanks for joining us and bringing us all those updates that are coming in from the state of Karnataka.